The provincial government is looking at adjusting the timeline for the second dose of the COVID vaccine, with reports emerging that the first dose isn't providing an adequate amount of protection for some with a compromised immune system.
I need that second dose to make sure that I have a fighting chance of being able to get my life back and be able to keep my health in the condition that it is right now, because I don't want to go back to the way I was before.
Kristen Evans received a life-saving kidney transplant just 6 months ago. She's scheduled to receive her first COVID vaccine tomorrow, but her mind is already on when she'll receive her second dose, and with good reason. This month, a study from Johns Hopkins University was published in the Journal of the American Medical Association, stating that the first dose of a COVID vaccine isn't proving effective for organ transplant recipients, in part highlighting patients may remain at higher early risk for COVID-19, despite vaccination, suggesting that a second dose might be needed far sooner than the 4-month wait between jabs currently mandated in Ontario. A second recently released paper that is yet to be peer-reviewed concludes that delaying the second booster shot of the COVID vaccine could leave cancer patients wholly or partially unprotected. When questioned by CityNews, Ontario's top doctors admit the emerging studies have their attention.
We have a clinical advisory group that we are working with to look at this and identify if there are any specific groups that should have a shorter interval between the two doses.
The Assistant Scientific Director of Ontario's COVID-19 Science Advisory Table, Dr. Nathan Stahl, believes the province has the capability to pivot and rework the vaccine schedule for those who need a second dose sooner.
They are evaluating the evidence as it arrives and will make decisions based upon that. This is the nature of evidence in real time.
For Evans, the pandemic has been a painful marathon. She's barely left her home for a year now. Her second dose of the vaccine is currently scheduled for July.
I went from being too sick to go out to being terrified that I'm going to get infected by COVID and, jeopardize the health that I've just regained.
The National Advisory Committee on Immunization has announced they're also reviewing the data around first dose efficacy rates for immune-compromised Canadians.
I'm expecting there will be recommendations in the next week or two about specific groups where the dose interval should be shorter.
The question remains, will the provincial government act once the recommendations are made? Thousands of concerned Ontarians will have to wait a little bit longer as a cloud of uncertainty swirls around their health. I'm Adrian Ghobrial for City News.